Hello and welcome to Beauty and the Biz, where we talk about the business and marketing side of plastic surgery. I'm your host, Catherine Maley, author of Your Aesthetic Practice, What Your Patients Are Saying, as well as consultant to plastic surgeons to get them more patients and more profits. Now, today's special guest I have known forever. It's Dr. James Newman. He's a facial plastic surgeon in private practice in my neck of the woods called the Bay Area. And that's near Stanford University in California. Now, he focuses on cosmetic facial surgery and is an innovator on minimally invasive cutting-edge techniques. Now, Dr. Newman graduated from Baylor University. He then attended the University of Texas, and then his residency was done at Stanford University, where he also joined the faculty for a while before finally going out on his own more than 20 years ago. Now, he has lectured throughout the country and abroad on the latest surgical and minimally invasive procedures. He's authored over 30 publications in peer-reviewed academic journals and continues to teach and train other providers. Now, Dr. Newman's also very active in many organizations, actually has his own medical conference that we'll talk about in a little bit, and he holds several advisory board positions with firms developing new technology in plastic surgery. Dr. Newman, thank you so much for joining me on Beauty and the Biz.
Well, Happy New Year. It's great to be here at the start of 2024, and we look forward to, a great new year with so many things going on.
For sure. My theme this year is Soar in 24. I just think it's got to get better. 23 was, I don't like that odd year. I'm happy now we're on an even year, and it's got to just, I'm feeling a lot better about it. So let's see what happens.
Absolutely.
Yeah.
Absolutely.
So let's just start with, I love the part about, and everyone likes to hear this too, how do you pivot from hospital setting to private practice? Do you remember, I know it's been a while, but do you remember what was it that got you to make that jump?
Absolutely. Well, I think it's all about wanting to give, the best patient experience. And when you're in a hospital setting, there's a lot of external factors that kind of control the schedule, the timing, the setting. And when you really start thinking about, doing more elective things than necessary reconstructive things, patients have a choice, and they want to feel like they've been listened to and that they have attention. And so the only way we could really match those patients' goals was to kind of establish a private practice where we didn't have the constraints of, timing and, getting bumped on the OR for other things. So that's why we really created our own surgical suite to match convenience for the patient and give that kind of more private experience. And so I still did a lot of reconstructive surgery for many years and just kind of slowly, transitioned. And when you do that, you just get all encompassed by your private practice. And so, although we still have fellows that come and spend some time with us from the university, we also train a fellow in the American Academy of Facial Plastic Surgery. So I still have that connection with the younger people coming in for their training and whatnot. And we attend a lot of conferences. And as you mentioned, we're very active in trying to put on some of these conferences just to keep up with the changing technologies that are occurring. It seems that every month, I pick up, a magazine or whatnot, and there's something in it that I'd never heard of. And it's just a matter of kind of weeding through, what's what with that. And that's what we try and do with our California Society of Facial Plastic Surgery, is we try and filter out some of the noise and really provide our members with a succinct analysis of what are the new things that can really impact their practices.
How important is the surgical and the non-surgical? Because it looks like you have really focused on both at this point.
Correct. As we all know, non-surgical technologies and procedures have been going up logarithmically. And certainly during COVID, we were very busy in surgery because patients had that downtime. So that was a little bit of an anomaly. But in the real world now, non-surgical, less invasive procedures are far outpacing the traditional longer-term surgical procedures. So we spend about probably, 2.5 days in surgery. And I would say of those 2.5 days, 1 day is devoted to, the traditional heavy-duty facelift surgery, rhinoplasty types of things. And then on the flip side, we have about a half day where we'll tack on some minimally invasive procedures where patients might come in to do, say, just a fat transfer with some exosomes, mixing up with like a little bit of some laser technology and trying to improve their skin quality. And then we've also seen some of the totally new technologies such as soft wave and therapy and thermage. Those technologies have improved over time, and there's new stuff coming out, each and every week. And there's a demand that the patients want to, do those non-invasive things. Not that they're always a candidate, but it's an important from a facial plastic surgeon standpoint that we can honestly tell the patient, will some of these less invasive technologies help them? Is it worth it to do? Sometimes it might postpone the eventual day where they might come in to do their full surgery. And certainly, I think that's a trend that many plastic surgeons have been seeing, whereas the average age of a patient, coming in for a facelift surgery, say 20 years ago, was really kind of in their early 50s. Now, shift that down a whole decade, it's really like an average age is more like around 60 to 65 because patients have a lot of different options and they're doing some of these other types of, whether they're more advanced fillers or non-invasive technology, they're delaying the need to do full facelift surgery. So the average age of a patient coming in has increased in our practice. And I think that's a trend that we've seen, across the country as well.
Yet I've also seen that a lot of the younger people are getting facelifts earlier. And I just think if you're having trouble, with your face at 40, 45 years old, wait till you get to be 60 and 65 years old. And another trend is once you've had a facelift, I'm taking this from personal knowledge, it's not like you're done. That
Right.
that facelift, you've handled the structure of your face, but you still have all sorts of little pieces that you can't stand. So
Absolutely.
there's so much more. I call it the long tail patient. Anybody who cares about how they look, they'll care today and tomorrow and 20 years from now and 30 years from now. And there's just so much more to do other than like, I love all this new skin tightening. I hope that they have made it a lot less painful because I've had all of that and I didn't appreciate the experience. And I thought it was a little subtle, but boy, if they could hurry up and work on that
Right.
technology,
Right.
it's like that post, whatever you want to call that, post facelift tightening or,
Yeah, it's going to be a combination of some of these different technologies. We're still kind of figuring that out. But to your point, the impact of social media for younger patients, knowing that they can have an early facelift, to kind of nip things in the bud. We have seen that with patients coming in wanting to do more quote unquote, minimally invasive incisions or even endoscopic surgery, where small incisions are made back in the hairline, and we can use endoscopes to go in and do some of these things. So there's a number of our colleagues who have popularized some of these procedures, and social media, makes more awareness. And so you do see some patients who, mostly in the LA area or New York, kind of on the coast primarily, where they do kind of look at, okay, I want to look as good, and whether they're in the entertainment business or they are in the tech business and they just don't want to age and they're working with younger people, they will tend to come in a little bit sooner and see about, doing, so for example, like the My Elevate procedure with some skin tightening. Certainly eyelid surgery is very, common because it shows signs of aging earlier on. So we still see younger patients coming in because they're seeing themselves on the phones and on social media. They see the shadows and everything, and that's driven many things, for us.
for sure. Now, since I've known you, you have grown quite a little empire there. You have lots of providers, a few other doctors. So, can you describe your practice and who's joined you since I've known?
So we're in the San Francisco Bay Area, mostly on the peninsula. So we have, two main offices that have two operatories, one in Palo Alto and one in San Mateo, that draws, patients from San Francisco, Marin, all the way down to San Jose, as well as the East Bay. So we have a lot of reach, and we have integrated oculoplastic surgeons as well as general plastic surgeons who focus more on breast and body to kind of give comprehensive care to our patients where they can come in and get everything. So we have three plastic surgeons who are quite active in our practice. And, I think some of them as well. And so they come in, and just for example, today, for example, the lady who I operated on today had had a tummy tuck back in 2018 by one of my associates. And now she's coming in for some facial work, and that works very well. And of course, we've also seen the growth of nurses and PAs, extenders who can get very adept at doing filler injections, neuromodulators, and some of the office-based procedures. In fact, I think the trends are showing that, surgeons, we're just too busy, and dermatologists have the time and they're doing well, but we are seeing that in plastic surgery offices, a lot of the injectable types of things being done by our extenders, whether they're nurses or PAs. And so I think we have three different nurses that work in our practice, and they all have their own, techniques of doing things, and they have a following of their patients, as well. So I think you're seeing that trend, a little bit more. And then we also see the explosion of the med spas. Okay. And I feel that the best med spa situation is one where you do have a core physician, whether they're a plastic surgeon or dermatologic surgeon or facial plastic surgeon, that is really on site, kind of monitoring, everything and getting the best of both worlds. Just because we have the depth of knowledge to offer, different types of treatments for the patients and make an accurate diagnosis on what the patient would benefit from. So there are the other types of med spas that are have a more of a corporate feel where they tend to push more, fillers or devices, over and over again. And sometimes, patients don't get the full consultation as far as what's happening. So, like for example, just today, I saw the spouse of a physician, and she had been going to a particular national chain med spa and just doing the same old things, but she had kind of reached a point where, she still looks tired and aged and wants to know what else to do. And we have the ability to make that assessment and take her to the next level. So I think that that's a challenge that many of us in our practices have. But as surgeons, we do tend to embrace the use of our nurses and PAs to enhance our practices. And that's one of the things that we've been focusing with our California Society of Facial Plastic Surgery, is to make sure that there's good training for our nurse injectors and our PAs. And that's part of what we do at our California Society meeting, which is coming up in February. And that's kind of a mission that we have, so that practices can rest assured that, whichever nurse or extender is in their practice has the best tools and training. And I think that it's a win-win situation for people in industry who kind of make these products. It's a win for our practices where patients have a demand for these things. And then our nurses and PAs can actually take more time with the patient and do these types of things. And because they're in our setting, they have a knowledge of, well, what surgery can do or what some of these other minimally invasive procedures can do. And they get a higher level of education. And I think you're going to be seeing that, whether it's the Aesthetic Society or our Facial Plastics Academy, and certainly dermatologic surgery and our American Society of Lasers and Medicine and Surgery. So there's a whole postgraduate, post-training type of world out there where we're trying to kind of find some pathways so that people can get standardized training on some of these things.
Well, then let me plug your meeting that's coming up, because I'll also be speaking there. It's on February 1 through 4, so it's coming up soon. It's called Skin Aging, Facial Plastic and Aesthetic Surgery. And it's in Lake Tahoe, California. For those who love to ski, this is the greatest meeting. You get up early, we meet, then we go skiing, then we come back and meet again later. It's a really fun meeting. Lake Tahoe is gorgeous at this time of year. But you want to talk a bit about your meeting and what to expect there?
Yeah, I think that you'll find that we have nationally recognized experts like you, Catherine, who are going to share very important pearls of wisdom and your experience. And we have a number of practice marketing people who know about some of the new trends and search engines and social media and what are the trends kind of going forward? Because I think for a lot of the younger docs, they get most of their patients from social media now, and the days of just having an ad in the phone book, are gone. Those of us who are more mature practices, we do rely more on our word of mouth referrals from our extensive patient database. But I think that the types of speakers that are going to be at this meeting, we're going to encompass practice management with wonderful speakers, and then the latest advances in our surgical techniques. And then we have a wonderful demonstration of some of the new injectables that are out. And we do live injections with high definition cameras. And we have a number of faculty throughout the state of California who are they do these types of fillers day in and day out. So whereas I may only do, a filler once a week of a certain type, these folks are doing it day in and day out. And I always learn little pearls about how that's being done. And then we also have a showcase of the latest new technologies that are out there, because a lot of people hear, buzz terms like Softwave or MyElevate or Matrix Pro and microneedle radio frequency. We kind of really have a number of experts from our dermatology colleagues who have done some of the research and explain why some of these new technologies are better than the old technology. Okay. And it's hard to keep up. So people can come in, you can see that real time, in the meeting, and we video everything and it's archived. So, our registrants can go back in time and you can look back 10 years ago and see what the state of the art was and the things that we were discussing. So we built up a nice video library of these trends that have amassed over the past year. So this is going to be our 22nd year. Okay. So that just tells you how long we've been doing this. And we get wonderful support from our partners in industry. And it's a great social setting, as you mentioned. You're an excellent skier because I've seen you on the slopes before. And we just got about a foot of snow here in Lake Tahoe. So it's going to be wonderful. And our meeting is pretty much sold out. But if you're trying to get up there, you can still go to our website and try and see if there's some additional space.
The website name is called S as in Sam, AFPAS, LakeTahoe.com. I would just Google Lake Tahoe anti-aging or skin or facial surgery conference. It'll pop up.
Yes.
It's a really good meeting. I love the injectables. Watching how some of the doctors have used injectables to turn them into signature packages. They are thinking outside the box, super creative. That's been really interesting too. Getting back to your business though, from a business perspective, you are so right on becoming the one-stop shop for an aesthetic patient who wants to look good now and 30 years from now. No patient that I know who has the wherewithal, who has the money, typically they also don't have the time. If you don't have money and time, usually you usually have one or the other. And to make it easy for a patient to get to know them surgically and non-surgically, they will give you money over and over and over. I am that patient, and I just think, I don't know why more people don't do that. You're a facial plastic surgeon. You then partnered with a body plastic surgeon, so you have nice boundaries. Do you all get along well, hopefully?
Yes, we do, because there's enough work for everybody. This old adage of, when you're first starting out and everything, there was some turf wars back in the late 80s, early 90s. Those are passe. And I attribute that to kind of the younger generations of surgeons who have learned in a multidisciplinary panel, which was really started, by my good friend, Dr. George Brennan down in Newport Beach, and Dr. Randy Waldman, who carried on the multi-specialty meeting in Las Vegas for many years. And, Dr. Waldman is a part of our program in Lake Tahoe. as well as our spring meeting. So you see that true multidisciplinary um, format. And so when you're in meetings and you're seeing each other and doing things and, and you're giving that patient the excellent care, it's wonderful because, many of us kind of focus in on our specific procedures and whatnot. Even within facial plastic surgery, there are some of us who just primarily do rhinoplasty now, or, uh, facial surgery or laser surgery. Everything's getting subspecialized, to a degree. And you can come to the meeting and see how all that works. But we want the best thing for our patients, and I think that our practice, which is known as Premier Plastic Surgery, kind of encompasses that multidisciplinary approach. And because we have ophthalmologists, dermatologists, plastic surgeons all together, and we have estheticians on site as well. And we also partner with a lot of the local estheticians who have you know their skincare spas and whatnot. Space is a premium, right? So you can't, that's the one thing is that when you're trying to think about developing a practice for the future, you got to think about, well, how much space do you need, and what are you gonna put there? And we've just been fortunate in that we've been a little bit ahead of the curve, and we've got things established, and it's really we have fellows that come in. We have different doctors that come in and spend a year with us or two, and patients just kind of, we're primarily word of mouth. We don't really have to spend much money on marketing, which is wonderful.
Well, and your word of mouth referrals are also in-house. If you would just cross promote to each other, you have like a beautiful microcosm there that's working internally. I think it's brilliant. I think that's the best business model going in today's world, if you can get it to work, So tell me what some of the challenges are, because that's a lot of different variables trying to work together, and that's not always easy. What are some challenges?
Yeah, so I think the challenges are, there's different personalities. So our situation is one where we allow each physician member to maintain a certain level of independence. Okay, so they're not tied in financially to one big group. So you really feel that you can kind of share in certain expenses, but you still have that independent identity. And so you're always striving to kind of build on that. You're not trying to hide behind just a big label. And we've had some people who, over the years who have excelled more at that and being kind of a team player, not letting your egos kind of get in between things. So those are some of the challenges. But I think that once people see that there's plenty of work for everybody, that and the camaraderie that can be established amongst the staff and whatnot, it's a win-win situation for everybody. And so some of our physicians, as I said, they have their other private offices, okay, as well. And they might just spend like one day per week with us in our office to see some of the consults and whatnot. So I think giving that flexibility for those practitioners works really well. And so I'd say um, sometimes it's hard for some entities, like especially now with private equity coming in and wanting to kind of control everything and make everybody fit into these molds. As a private practitioner, we can maintain that level of control and independence, and not be burdened by some large group that are primarily looking at numbers and that sort of thing. So we still want to be smart and not overspend and do things that are reasonable, but giving that level of independence allows our providers to go on vacation when they want, and feel like they're not taking a big chunk of overhead that they have to kind of make. And so I think that works out pretty well.
And what about, I know you have 4 different locations. Is there any room for growth, or, and those private equity people must be after you. So are you tempted at all?
Um, Not at this time. I mean, I think that when I've talked to some of my colleagues and who have gone the private equity route, um, is never as rosy as you think it's going to be.
That second bite of the apple, I,
Yeah, right.
there's a big question mark on that one.
And I think that we run things, very efficiently because we're responsible for everything. And our other two locations are just small offices, which are convenient, one on the coast and one down in the South Bay. We have estheticians stationed at all those offices, so there's always people coming in, and they can we can see the consults, over there and that sort of thing. And it's just we have like a little feeder system that comes into our main providers, but we're not looking to expand more. I mean, there's only so much that you can do, and if you start spreading yourself too thin, then you just can't cover all the bases and stuff. But I think private equity in the future, if it's the right model and things, we could look at that. But right now, I just don't see that, because if you go in, you're basically marrying your practice to another practice, and then you have to look at, well, how they're running their practices the same way you do, and oftentimes it's not, and it's difficult. So, and I think that within a cosmetic practice, the people are really looking for you as the individual and the brand that you've built. Whereas it might be different in dermatology, where you've got the reimbursable types of recurring, you know, treatments and diagnoses that are going through, and the cosmetic stuff is like a little extra on the side. So those models, they want like predictability, and I tell you, there's not as much predictability in the cosmetic world, as in the reimbursable world. So I like maintaining, some degree of independence, and so maybe I'll look at things again in another few years, but right now we're happy.
Okay, that's great. So let's talk about branding for a minute, because when you come together like this, are you still your premierplasticsurgery.com, but the others are independent more or less? When it comes to social media, or when it comes to the web, is everybody separate? Does everyone have their own branding on
Yeah,
social
everybody has
media?
their own branding, but they all have a page on Premier Plastic Surgery, and they can, people can find them a number of different ways. So we encourage people to have as many, social media things as they want, and because we don't really go out and buy a lot of marketing and that sort of thing. It's just served us well, and you know, uh, although we have kind of an overall brand name, it allows us to, change physicians periodically. Somebody retires, somebody moves. There's that, reminiscent name recognition, just like a university would be. Okay. So we hope that we've been able to build a reputation in the area that people know that if they come to Premier Plastic Surgery, they're going to get somebody with a high level of education and experience.
Right. And do you think there's anything, the patients and the trends and what they want and don't want? Like we already talked about, some of them are getting much younger, some are getting older. But what do they want nowadays? And do you find it constantly changing? And what's your consultation like nowadays? Is it a lot different than it used to be?
Yeah, no, not really. I mean, it's still they want to look, they're noticing the aging that's taking place, and so I think the big thing is they want to look themselves in our area of Northern California, which tends to be a little bit more conservative, and definitely lip fillers are a lot more conservative up here compared to down in Southern California or Arizona, for example, or Texas. And I would say that you know patients want to look natural, and that's their biggest concern. And when we can kind of put them in context and explain to them why we do different things, and we always look at their pictures from before, and we go over that and we explain what things have happened, in the process, whether they've lost, uh, fat, collagen, they've got like a lot of sagging and the different things that we have to address. Patients just want to look like themselves, like a fresher version, of themselves. And a lot of times I think is a little bit of filler fatigue, out there, where sometimes people have relied on fillers to do, much. And then you hear about people, then, some celebrities who have gone in and dissolved some of their fillers because they just went a little too far. You start losing, kind of a frame of reference of who you were. And so we typically don't let that happen, with the patients. And so I would say that our average number of, volume of syringes that we do for a typical filler patient is probably half of that, where, of some of the other, big practices that, especially like some of the med spas and whatnot, where they're financially motivated to, make profit. And the way they do that is by doing more and more and more. And in our book, that's not the best way. And that's why we have, patients who are with us for life, and they stick with us.
From a patient perspective, if you overfill me, I'm not coming back. I look ridiculous, especially in photos, and you get a reputation for that. I would be very careful with that. Less is more. Let them come back more often for little versus one big dump. um, I don't think that's good business. What do you think about like photos? Any secrets for how you get the patients to approve their photos, give you a good review, give you a video testimonial? Social proof is just more and more important as SEO gets tougher and all of that. Any tips on that?
Yeah, that's been a challenge because most of our patients are private. They don't want to have their pictures shown. And I'm always amazed how some of my colleagues can get, people just to show off on, social media quite a bit. So, it's just the nature of our practice. And so we have, sometimes patients will let us show the bottom half of their face, but not their eyes, that sort of thing. And to us, we have enough pictures that people can kind of get an idea of things. But, some people give like discounts, to patients to let us use their images. And some of our younger surgeons coming in, they try and do that so that they can build a little bit of a presence on it. But there's just different psychology amongst some patients. Some people are just so thrilled. They want to have their face out there, and that's great. I would just say that in our practice, in our area, that's not the case. So we just have to kind of, bite the bullet and just have a few images of things to look at. We do let patients talk to patients who've had procedures done where they don't have to show their face. And I think for us, that's worked very well because they have trepidation about, things that were going on. And, when patients go through a full facelift, chemical peel, um, fat transfer, they can look terrible, during the first few days. And being able to talk to somebody who's gone through that is more important when you're trying to kind of close the deal and get some trust that everything's going to be okay. And so it's tough. It's not. I mean, I think that social media minimizes kind of the downside. They just show, oh, these wonderful pictures, before and after, and that's great. But there's a little bit more recovery, that we all know that takes place. So we always show patients some of those, recovery pictures so that they're well aware of what they're in for, so there's no surprises.
Are you participating in social media or staying away from it?
I say I'm pretty minimalist, on social media. Um, I think it's always fun to kind of see what your friends are doing and that sort of thing. I like some of the travel sites to see what's going on. I try not to bother our patients too much, so we'll post something maybe once every few weeks, but not certainly every day or several times a day, like some people do. So if we do a post, it's like once every 2 weeks.
Holy cow. Yeah, it's an everyday thing. They want to know you. They want to see you. I'm telling you, if you had somebody following you around and directing you, to make you look good, it's the day in the life of a plastic surgeon.
Right.
You have so much content every day. It's amazing. So
Yeah.
there's
I
a
think
lot
it
there.
can be a little invasive on your life. I tend to, I have kids, I have a pretty busy life and other interests, and I don't want that constant um uh a spotlight, sort of. So I feel bad for some of my friends who, are in that spotlight because I don't think they can truly relax, sometimes, when you're an influencer and a lot of them and stuff. So
They're on.
it's all consuming.
Hmm.
And if you go off, people think you died.
Yeah.
So this way I kind of just keep a low profile, which I'm
For
happy.
sure. The last question. Tell me, do you have any crazy patient or staff story that would be fun to share?
Well, I mean, it's amazing. I mean, like I had a patient today who was a month out from her procedure, but she actually wrote me this thank you note. Okay, and I'm going to just read the first
Oh,
paragraph. And this is just what your patients sometimes think. It says, "Dear Dr. Newman, that was a wild ride. I had someone come up to me and tell me I looked sad. I thought I looked mad and fat. I honestly thought I had a botched procedure. I'm so very grateful I've gotten to the point where I am glad that I had the procedure done, and I can sincerely thank you for your great work. Thank you." So, I mean, that's an example of where, patients during the first couple of days, what's going through their mind, they think that, maybe they've been botched or something like that because they have extreme swelling or something. And it's very important that you have, some kind of, good patient communication, with these folks. So I mean, this is just, from the gal, and of course she's very happy. She looks wonderful, but just to know that during the first, couple of days, she thought she was botched because of all the swelling, and her lips were swollen and that sort of thing. It just reminds you that, patients need a little bit more hand holding, with things.
if you wanted my recommendation, if you can get a patient to do a daily diary, daily photo diary, and
Mhm.
then you have a little photo book in the office, and it's a a pre-op thing. You just show the because it's an emotional roller coaster,
Right,
this whole deal, and if you can just prepare them ahead of time for that, because she went through a couple days of questioning you, you
correct,
know. And you don't want that. Yeah, you just
right.
want her to be forewarned. You're going to hate life for a minute, and then you're going to love it. Yeah.
That's right. That's right.
Yeah.
So, I mean, oftentimes we get a little cavalier as surgeons that, okay, this is, another facelift, the patient should be fine and whatnot. But you're absolutely right that, everybody handles things a little bit differently. So, um, I just think you just have to be, aware of that. And sometimes, you don't know how stable some people are, but she's a very lovely lady and she's extremely happy. But I was just like, whoa, you know, that she thought she had had a botched procedure.
I love that she shared that with you.
Yeah,
That's so important to know because you don't want to hear that on your review, you
no,
know?
that's right. No, and stuff. So she gave me a great review, but we have had in the past where some patients are a little bit immature, and if they jump on and do a review like within the first day or two when they're still swollen, it makes no sense. So um, we tend to have nice stable reviews with everything. So
So we're going to wrap it up now, but overall, because you've been around and you see what's going on and you're part of what's happening, what's coming down the road, where do you see all of this going? Because it has changed overnight. This whole private equity thing has changed. New people coming on, new surgeons who don't want to work 24/7. They do want to have a life and go home for dinner. Where do you see all this going?
yeah, I think it'll vary by market a little bit. I think that there's the quote fear of missing out, you know, and I think that there's going to be a little bit of not backlash, but I think the private equity stuff is going to kind of die down a little bit when you talk to people who've been in it for 3 years and they go, "Are you happier now or when you had your own practice?" It's I think there'll be some shifts in that. So, not that the private equity people are bad people, they're just, business people. And they're looking at the numbers and making everything work. And, but I think you will see a little bit of some of these private equity groups kind of fade away a little bit and get out of medicine a little bit.
But do
And
you think solo practice is going to go away and people are going to start grouping together to pay for things?
no, I think the model of like we have of sharing some expenses together and having a multi-specialty multidisciplinary clinic will be the model. And especially now with the young people, you know they're a lot less um, uh, cutthroat or competitive than it's like right now in medical school. First 2 years of medical school is all pass fail, so that kind of um, mantra of I got to get ahead, I got to be ahead of this person, that person is kind of fading away. And when you know that you're all in it for the good of, taking care of everybody, that will kind of, improve things. So I think there'll be less kind of cutthroat behavior, and people will tend to coalesce and go into practice together a little bit more. It just takes the right kind of vision, and you have to get along with people and check your ego in at the door, a bit.
Yeah. If anybody wanted to get a hold of you, I know your website is premierplasticsurgery.com. Is there any other way you'd prefer to be contacted?
If they want to get a hold of me, they can always, talk about social media since I'm not on it that much, but um, I don't get that many messages on social media. But if you go to at Dr. James Newman, you can just ping me a message. And, I look at it like once a week, so I'll usually get back to you.
Okay. All
Okay.
right. Well, thank you so much, Dr. Newman. I can't wait to see you in a few weeks in Tahoe. By the way, if anybody wants to attend that meeting, just find it online or DM me. Actually, that's a good idea. You can DM me at Catherine Maley, MBA, or you can leave me a message on my website at catherinemaley.com. And if you mention it, you can get 10% off the registration fee. But you'll have to tell them because we don't have a special code for it right now. But and everybody, that'll take care of it for us today. If you have enjoyed this, please give us a nice review. We sure would appreciate it. And then if you've got any questions or feedback, honestly, put them on my website at catherinemaley.com. All right. Thanks so much. Talk to you soon.
The fastest way to success is to model other successful surgeons who have what you want. But you can only see their results, not the path they took to get there. So you continue to jump from one thing to another, hoping to find something that will work for you too. But it rarely does. So try this shortcut instead. It's guaranteed to move you forward. I compiled my intellectual property to grow cosmetic revenues, everything I've gleaned over the years, into one playbook of the most successful practices and what they do to win. Go to cosmeticpracticevault.com and let's grow your cosmetic revenues.